Hello, everyone. Welcome. This is Mrs. D from Edme Nursing Tutoring. Today, we are going to cover the EKG quiz that was posted on our website. I'm excited to go through this to give you guys a quick overview on how to quickly identify an EKG question if you were to see it on the NCLEX. Now, I'm not going to go in depth about nursing interventions or pharmacology or things like that. That will be discussed further and more in depth during our EKG Mastery session happening on September 27th. We have a 10 a.m. session and a 6 p.m. session, and each session is 2 hours long. So please make sure you guys register for that at the very end of this video. Stay for the very end. There's a QR code that you can scan, or you can go directly to our website if you know you want to be part of it and you're like, yes, I need this type of assistance. I want you guys to go ahead on our website at edmetutoring.com. Again, that's edmetutoring.com. And I want you guys to go ahead and register. You will just keep scrolling down until you see the NCLEX EKG Mastery session. All right, guys, let's get started. So let's start off with some quick tips. So this is just simply if the NCLEX was to show you a rhythm and you were to look at that rhythm and it asks you to identify that rhythm. These are some 4 quick tips that I use to quickly identify EKG rhythms. The first question is, look at the QRS complexes and ask yourself, is it a narrow QRS complex or is it wide? My go-to is that if it's narrow, think more atrial type of rhythms or sinus rhythms. Okay, so it could either be an atrial rhythm or a sinus rhythm if they're narrow. Anytime you see wide QRS complexes, that will always be a ventricular rhythm that you're looking at. Okay, so that's the first. The second is to then look at the P waves. Is there one present, right? Or is it hard to identify it? Or is it coming and going? And so if you cannot see a P wave, that means that you lost that atrial kick. So that's typical for like your tachyrhythms, for example. Your tachyrhythms are typical for losing P waves because your heart's not relaxing long enough to get that atrial kick, which is going to help depolarize your ventricles. Okay. So ask yourself, is there one present? And a lot of times, you will also find that if it's not present, you have some kind of issue with your heart. Okay. And then sometimes it might be lost in something. Okay. And that could be from like AV blocks and things like that. Then ask yourself, what's the rate? So you'll count the R's on your strip. Okay, you count the R's and then times it by 10, and that's typically your rhythm. Normal is 60 to 100. Anything below 60 is considered a Brady rhythm. Anything greater than 100 is considered a tachyrhythm. Never changes. 60 to 100 on the NCLEX is always normal. And then lastly, look at the whole strip and ask, is this sinus or irregular? Sinus rhythm, your R to R will always be equal. Whereas things like atrial fibrillation or ventricular fibrillation, like any fibrillation usually will have some kind of irregular rate or irregular look. Okay. So a flutter, fibrillations, you'll see that it's like all over the place. It's not equal from R to R. So let's take a look at the first. So look at this rhythm. And remember, I told you the first step is to identify what is my QRS complex looking like? Is it narrow or is it wide? As you can see here, these complexes are narrow. So we know it cannot be a ventricular rhythm because ventricular rhythm, like I said, is wide QRS complexes. So we would eliminate any ventricular type of rhythms. Then move on to the next step, which is, okay, do I see a P wave? Well, we don't know if this is a P wave or a T wave. We can't really put our finger on it. So that means that we probably lost that atrial kick or it's lost somewhere in this rhythm. So now we know we're looking at some kind of irregular rhythm. We know it's not going to be like a normal sinus. We know this is definitely irregular. This is not a normal sinus rhythm. All right. This is not something that is normal for a client. We then move on to what is the rate? Well, we're going to go ahead and count this. So it's 10, 20, 30, 40, 50, 60, 70, 80, 90, 100, 110, 20, 30, 40, 50, 60, 70, 80, 90, 200, 10, 20, 30, 230. That's how fast this person's heart is going. It is just running. All right. So we know that this is probably an issue in the atriums. Okay. And then lastly, look to see if it's equal to equal. Each one, if you see, is about one box 1.5 blocks width, which is just about what each of these are doing. So it's not irregular. So we can't say it's a fibrillation. It's pretty regular. So we know that this is a type of sinus rhythm, the sinus tachyrhythm, but we know that it's definitely going to be somewhere up in the atriums. Okay. And if you remember, in order for it to be ventricular tachycardia, the QRS complex has to be wide. So if you're thinking it's ventricular tachycardia, it's immediately wrong because one, the QRS complex is narrow, so that immediately means it's not a ventricular rhythm. So it can't be anything ventricular. So then you ask, well, is it atrial fibrillation? Well, no, because this is equal. AFib is irregular, right? These are equal, all right? The R to R is equal. Now we know it's definitely a fast rhythm because it's about 230. So what we can deduct then is that this is probably supraventricular tachycardia, or SVT in other words. All right, that's the way that SVT looks. It looks pretty normal. It's just very fast and rapid. The QRS complexes are normal, but we kind of lose that atrial kick somewhere because the heart rate's just too fast. So then look at this one. Now let's look at it. We're going to say, oh, do I have a P wave? I can't find my P wave. QRS complex, is that narrow or wide? It's narrow. So we know we're not looking at a ventricular rhythm here. All right. So we can eliminate ventricular anything. Then let's count it. 10, 20, 30, 40, 50, 60, 70, 80, 90, 110, 20, 30, about 130. So this is a tachy rhythm. So we know it's tachy. We know it's not ventricular. Okay. Now let's ask, is it regular? Definitely not. Any fibrillation is going to be irregular. It's not going to be normal. Okay. So anytime you see a fibrillation of anything, whether it's VFib or AFib, it's not normal. It's irregular. So that means that if it's a narrow QRS complex, sorry about that, narrow QRS complex, it's rapid. I don't see a P wave, and it's not regular. It's irregular. You're looking at AFib. Okay. This is AFib. Now let's move on to this rhythm. Well, it literally breaks every single rule or quick tip that I gave you. The QRS complexes are not narrow. This is definitely rapid because, I mean, look at that. We don't even know if we can even count that really. All right. I don't see a P wave. I don't see any regularity anywhere. Okay. So this right here, I don't even see a QRS complex either, technically speaking. This is very fibrillating. This is a fibrillation. That means it's VFib because that QRS complex, again, is not narrow. All right. So if it looks like squiggly lines, like a little kid drew it, you're probably looking at VFib. Now, I know that some people are like, well, how do you tell the difference between that and torsades? Torsades looks a little more organized than this, okay? And so just bear that in mind that torsades is a little more organized, and it looks like it gets small, then big, and then small, and then big. So it looks like it's spiraling, okay? This right here is just looks like scribble from a little kid. So if it looks like a little kid scribbled it, VFib. And then the last one, look at this. This looks a little more regular. You see that? So first question is, what's that QRS complex looking like? Is that normal or wide? That's wide. That's not narrow. This is wide. So we definitely know this is definitely a ventricular type of rhythm. Where's the P wave? I don't see one. Okay. So we know that we're losing that atrial kick. Okay. So this is definitely not any kind of sinus normal rhythm. Okay. Normal sinus rhythm. And then let's count it. 10, 20, 30, 40, 50, 60, 70, 80, 90, 110, 20, 30, 40, 50, 60, 70, 80, 90, about 200. Okay. The heart rate's about 200. All right. That's a rapid tachy-rhythm. So we know this is a emergency situation. And then the last thing is, well, is it regular? In this case, it is. Okay. So we know that if it's a wide QRS complex, it's rapid and it's regular looking, right? We know that it doesn't look like squiggly lines. So it's not fibrillation, right? Because remember with AFib and VFib that we just covered, you can see fibrillating lines. There's no fibrillating lines here, but there's also no P wave here. So there's just that wide QRS complex. If it looks organized like this and the QRS is wide and there's no P wave and it's rapid, you are looking at ventricular tachycardia. Now, whether or not it's pulse or pulseless, that doesn't mean anything because, again, this is just telling you what the electrical activity of the heart is doing. All right. You have to literally feel for a pulse to know if this is lethal VTAC or emergency VTAC. What do I mean by that? Emergency VTAC means I need to act right now to reverse this. That's the type of pulse, a pulse VTAC, meaning the patient still has a pulse. Whereas lethal is they don't have a pulse and they have this rhythm. So if they don't have a pulse and they have this rhythm, you're looking at a lethal rhythm. If they have a pulse and they have this rhythm, it's an emergency situation. So we need to hurry up and reverse this before it becomes lethal. All right. So if you said VTAC, you were correct. I hope that you remember these tips. I just want to cover the tips one more time. All right. So look at the QRS complex and ask narrow or wide. Narrow usually means atrial or not the ventricles at all, and wide means ventricle. P wave, is it there? A lot of times when you have a tachyarrhythm or a block, you might not see a P wave. Okay. So we know that you're looking at a block or some kind of tachyarrhythm a lot of times if you can't find a P wave. All right. Rate. Ask normal or Brady. So is it less than 60? Is it greater than 100? Or is it within the 60 to 100 range? And then lastly, look at the whole strip and ask, is it sinus or irregular? So is it regular when you look at the R to R from each one R to the next? Or is it irregular, meaning it's not, I can't even determine if it's even following the same pattern. All right. So I hope that was helpful, guys. If you struggled with any of these rhythms, I want to strongly encourage you to sign up for our EKG Mastery session. As I mentioned at the beginning of this session, it's happening September 27th. We have 2 sessions, once again, one at 10 a.m. and one at 6 p.m. Eastern Standard Time. You could either go on our website at edmetutoring.com to register, or you can go ahead and scan that QR code right there. All right. Scan that QR code right there, and it will take you directly to the registration for that session. We would love to see you guys there. Again, September 27th. You don't want to miss it. We're going to get even more in depth about those type of rhythms and more. We're going to include more rhythms, but we're also going to go over nursing management. We're going to go over pharmacological interventions, right? Medical intervention. So like, do we need to fibrillate this? Do we need to cardiovert this? Do we need to do some kind of ablation? What do we do about these things, right? As nurses, what do we expect to do and how do we manage these type of clients? Signs and symptoms. I mean, it's going to go very in depth so that you know how to answer any EKG question on the NCLEX. And even if it's not the NCLEX, if you're in nursing school and you need to learn this, let's say you're struggling and you're like, man, I'm struggling with this. I'm in cardio, or anytime I see a cardiac question, I can't get this right. You're in the right place. Go ahead, scan that, join us. We're going to help you. You're never going to forget it. I promise you. All right, guys. I hope this was helpful. I pray that you guys have a wonderful, blessed day. Keep up the great work. Keep practicing. You could also go on the American Heart Association website where you can do like the BLS and all that. And you could also get more in-depth information on how to identify rhythms as well. Strongly encourage that as well. I hope this was helpful. I hope you guys have a wonderful rest of your day, and God bless you guys.